Hey everyone, it's Dr. David here. Welcome to our channel. Welcome to this video. We're going to answer the question, will squats help or hurt my knee arthritis? Those of you that are live with us, thank you so much for joining us. I see Blessed Tree from New York City. Hey, what's going on? And Tamika McCoy, also from New York City, also from the Bronx specifically. Fantastic. Thanks for joining us, Tamika. Those of you that are with us live, if you could just give me a check that you can hear me. I hope I'm not just talking to myself. Just type in on the chat here and let me know that you can hear me. Say I can hear you or something like that. And if you haven't already told us where you're from, let us know where you're from too. I love to see all the people joining us from all parts of the world. It's so cool. We got Soso Lobi. Hey, Soso Lobi. Clara, I can't pronounce your name, Clara. We're going to answer your question though, Clara. Thanks for joining us. So crystal clear, fantastic. Thank you so much. And then we got Deef Allah Bani Hamad from the Middle East, from Jordan. Fantastic. Thanks for letting us know you can hear us, Tamika. And Susan, welcome back, Susan from Denver. Great. All right, you can hear me. Let's get into it. And as always on our live calls here and our live streams, you can ask me questions. I'll go through some information on here that's hopefully helpful to you. We're going to be answering, if squats are good or not for you. But if you have specific questions, I'll take little breaks as I'm going through. And if I wrap up, at a decent time, I don't have too much time here. I've got patients on the schedule, but we'll answer your questions. So let's get into it. Will squats help or hurt my knee arthritis? And the quote from Clara here is, I have osteoarthritis. I really want to do a squat challenge for 30 days. Would I be aggravating my pains? I really need to lose weight. Even doing walking exercises, I have pains. I really need your advice. I'm so sorry that you're dealing with this, Clara. This is no fun at all. But let's talk about it. There's two factors that you need to be thinking about when it comes to whether or not squats are going to be helpful for you if you're dealing with knee arthritis. And when we're talking about knee arthritis, okay, if you're watching this video and you're not dealing with knee arthritis, but you have another knee problem, like maybe a meniscus problem, a ligament problem, this isn't going to exactly apply. Some of it will, but not all of it. And you could have a meniscus or ligament problem with arthritis. That does happen. And in that case, this will apply to you. So arthritis kind of takes precedence over a lot of things in many cases, not all, but in many. So if you've got arthritis, it's going to be applicable to you for your knee problem. The number one thing that you need to pay attention to, this goes for you, Clara, and everybody else with knee arthritis, is your irritability level right now. So let me explain that. I'm going to unpack that. How irritated you are right now in your knees is going to determine what you could do and what you shouldn't do, what you should and what you shouldn't do. So you said, Clara, that even walking is hurting your knees. Chances are that means you're pretty irritable. Now, it depends on how long you're walking, how much time you're on your feet, because we could talk walking, but also if you're standing around for 30 minutes while walking, like if you go to the store, for instance, going to the store is typically walk and then stop and shop, look around, pick up a product, and then you keep walking. So it's a lot of stop and go, and there's a lot of time on your feet, but you may not walk that far. But total time on your feet is what I would look at. Let me give you some numbers, and this isn't anything that's scientifically researched. This is stuff that I found here in the clinic treating patients as an expert treating knee problems. If you can tolerate standing about 30 minutes or more, and that's standing and walking, just time on your feet total is what I should say. If you can tolerate standing and walking or being on your feet for 30 minutes or more, then you have a shot at doing squats, but just a little bit of squats. A 30-day challenge is going to be way too much squats for you. And then we'll talk technique in a bit. I'll show you. But how you do your squats is going to be a big factor as well, because the pressure on your knee joints is going to be something to consider. Now, if you've been diagnosed with knee arthritis, maybe in the past you've had knee arthritis, but you feel like you don't really have any limitations on how much you're walking around, how much you're on your feet. Like maybe you get a little bit of pain here and there, but you can be on your feet hours and it's not really a problem for you. then you're going to more likely do squats and be just fine. In fact, as long as you do everything correctly with squats, it's going to help you. It's actually going to help you prevent your knee arthritis from getting worse. And it's going to reduce the pressures on your knees so that you can set yourself up to be more active and move farther away from having some unnecessary surgery, hopefully no knee replacement later on in life. So I hope that makes sense. If anybody has questions, those of you that are live with me, you say it doesn't make sense, explain it better, I'm happy to do so. So just to sum that up, again, irritability is a big factor. And to give you the other extreme, if you're on your feet for just a few minutes, like if you're walking around in your home or you don't feel comfortable going outside to get the mail or going to the store and walking around, your knees you just pay for it. Your knees hurt a lot after being on your feet for just a few minutes, 5 minutes or less, or 10 minutes or less. Squats are absolutely not for you. Even if you do them good, you're just too irritated to do anything that's on your feet at that point. You need to be doing offloaded exercises where you're not putting a bunch of pressure on your knee joints. So I hope that makes sense, just to give you the two extremes. So if you feel good, you can walk all day, you don't really have any trouble, squats are a possibility for you. I'm not saying 100% go do them. I'm just saying you might do them. If you can't stand very long, your knees hurt, maybe you swell and you've got arthritis on top of that, then you should not be squatting or even thinking about squatting. You need to be doing other stuff first to make sure that that swelling gets under control, that your flared up, irritated knees become unirritated so that you can move on into more complicated stuff. So let me go to the comments here, and then I'm going to talk about the other factor that helps that you need to consider when looking at if squats are good for your knee arthritis or not, which is technique on the squats. So let's pick up where we left off. There's Susan. Tamika says, thank you. You're welcome, Tamika. I'm happy to do this. Lucy Tooley says, I can hear you from Seal Beach, California. Wow, we're in California. Fantastic. Thanks for joining us, Lucy. Susan says, thank you. Love your solutions. I'm glad. I try to give as practical stuff as possible. No medications, of course. I'm not a surgeon, nor do I ever want to be a surgeon. I just know how to do this stuff without surgery, and not everybody's cut out for it. Some people do need to have surgery. I need to make that clear. Like there's people that I see here in the clinic sometimes that I tell them, I can't help you. I'm sorry. I can only go so far. I'm not a miracle worker. Go see the surgeon. You need a replacement, or see what they have to say to you and take it from there. Akbar Kanji from Canada. Thank you for joining us, Akbar. Mel Middlemiss from British Columbia, Canada as well. Fantastic. Thanks for joining us, Mel. Soso Lobi, I don't want to push ahead or disturb your live, sir, but I have a quick small question. Sometimes out of the blue when I walk, my knee hurts so much, I can barely walk and then it's gone. Interesting. That sounds like it could be an alignment issue, Soso. It probably, if it hurts just out of the blue, like it doesn't really hurt and then it goes away, there's no lingering pain, there's likely an alignment issue. So I'll show you what that looks like. Here's the knee joint. I'm going to angle this down just a bit so you can see it better. So the knee tends to bend and straighten, right? Those are the main motions that everybody knows about. There's a little bit of twist in the knee, though. We call it rotation. And then there's a little bit of side gliding. So it can move sideways like this. If you have a ligament problem, like if you've ever had an ACL injury, MCL injury, those are the most common things that set up this excessive side-to-side motion. Because if you do shift one way or the other, you get an alignment issue in the knee. And it's such a small amount of motion that your knee will still work. You can still walk and finish your walk and walk the next day, probably, unless it gets really irritated. But it'll hurt. You'll feel that your knee is off a little bit, and typically gets really tender on the inside of the knee. The most common shift is inward. The bottom bone goes inward like this. And oftentimes, if you keep moving around or if you do the right things, the knee will realign itself and then it's gone. That's why it feels like it just comes out of the blue and then it goes away just as fast. And then sometimes it doesn't happen at all. I get this problem from time to time. I know what it is, thankfully, and I can kind of wiggle it loose on myself. In fact, we did a knee video on this. It's called How to Fix Inner Knee Pain in 2 Minutes. we talk all about this. So we'll link this in later on so that you can find that video on how to fix it yourself. And we've got a good response from people fixing it on their own. That's been one of our best performing videos on our channel. So I hope that helps you out. Okay, let me go for a few more comments here. Hyacinth Waf or Wa, I'm not sure how to pronounce your name, from Jamaica. Thanks for all the information. Helps a lot. You're welcome. Tamika McCoy, bilateral osteoarthritis, bone on bone, gel shots 3 weeks ago. Oh no, 5'4", 309. Need to lose 100. Getting to the bathroom from the bedroom can be challenging at times, but I have to / want to do. So when do you start something like squats with my level of condition? Great question, and very applicable to what we're doing here, Tamika, we're talking about today. I would not be doing squats right now. If you're having trouble getting to the bathroom and to the bedroom, that means that you're very irritated in your knee joints. Weight is an issue as well. For most people, they don't need to worry about weight so much, but if you're more than 100 pounds overweight, you absolutely need to make that your primary thing that you fix first. You need to address the weight. That's going to make you feel tremendously better. Being lighter is going to take pressure off your knees. But people that are just like 60, 70 pounds or less overweight, they typically don't need to worry about losing weight as a priority right away. But if you're over 100, it's definitely the priority. And then if you're in that range, like 60, 70 pounds to 100 pounds, it's a toss up. Yeah, you need to work on both at the end of the day, but I think you could get away with doing a lot of the strengthening stuff that we promote, and you'll be all right. Now, if I know it's tough, the situation that you're in, Tamika, because you're probably thinking, well, I want to go exercise, but my knees hurt and I'm trying to get over this knee pain, but I can't do much. And it is definitely, you're stuck between a rock and a hard place. I would just focus on the weight loss right now, and don't do exercises that you can do lying down, sitting down, do stuff that does not aggravate your knees, which there's plenty of exercises that you can do lying down on all fours, on your side, on your back, sitting down. And of course, watching what you eat is a big deal for weight loss. That's, I think, 80% of it. Exercise is kind of a smaller chunk of it. But making sure that you talk to a nutritionist or a dietitian could be of great help, or join some sort of program that works for you. In my opinion, when it comes to nutrition, there isn't a one size fits all diet or plan. You've got to figure out what works best for your schedule, for your time, for your preferences, for what's available to you. You've got to weigh all those factors and see what helps you the best. But hands down, you got to shed that weight off. I think once you get a good 50 pounds and you have some momentum, once you get to your goal of 100 pounds, Tamika, you're going to feel fantastic. Then exercise is going to be a lot better. And once you can tolerate being on your feet for 30 minutes or more, then you should be able to start to think about squats. But right now, do not think about squats. Go get that weight off as fast as you can, and safely, please. Don't do anything crazy. Susan says, I have to call BR. Okay, Susan, we'll see you in a bit. Lobi, I wish you health. She's cheering on Tamika. And Clara says, yeah, thanks. It does make sense. I noticed standing to cook or do house chores makes me hurt afterwards. So this is what I'm talking about, Clara. If you're on your feet just doing normal stuff at home, you're probably irritated right now, and squats aren't going to be a good idea. I'm sorry. Deef Allah Bani Hamad says, I have the right knee. I was unable to bend it, and after a while, it was treated, but there was muscle atrophy. What is the solution? Oh, well, muscle atrophy means your muscles got smaller and probably weaker. You have got to get stronger again in the right way. If you're looking at your thigh muscles on the front of your thigh, your quads, chances are you don't need to focus on that. You probably need glute muscle strength. But it really depends on, you have to give me some more information, Deef. I'm not sure exactly where you're strong, where you're weak, but chances are you've got to get stronger. Once you get stronger, if you've had an injury in the past and you got an atrophy, getting stronger is a huge goal that you need to set at the very beginning to make sure that you normalize pressures in your joints again, and that when it comes to using both legs, that you're using them more symmetrically, more equally, so that you're not overloading the leg that's healthy, and then you start to have problems on that side, or into the spine, into the lower back. You can have problems there as well. All right, Sandra, I'm going to read Sandra's, and I'm going to cover my second point. Nice to meet you from New Zealand. Hey, we're on the other side of the world. Fantastic. I have OA, left knee, so osteoarthritis, and I can't stand for more than a few minutes. Why do the injections not relieve my pain? Great question, Sandra. That's a good one. So you're very irritated, obviously. If you can't stand more than a few minutes, that's exactly what I've been talking about. When you put pressure on your knee, it's already irritated. Let me give you another example. It's as if I took my knuckles and I just rubbed it on the back of your hand. You could take that for a while, maybe like a minute or so before you're like, gosh, get off that. That's starting to burn or hurt me. But if you were to do that all day long for hours or even days or weeks or months, your skin right here where I've been rubbing would eventually turn very red, probably even open and bleed. It would become injured. And if you have too much pressure inside your poor knee joint and you're moving on it all day long, you're walking on it, it's injured. Your cartilage, your meniscus, all the tissues in there become injured because you're over pressurizing the joint from a muscle imbalance. That's usually what sets us off. And then if you're already irritated, just like if the back of your hand was already raw or injured, and then you go to rub it again, well, you're only going to be able to take a little bit of pressure or none before it starts to hurt again and possibly swells. So no amount of an injection is going to fix that. If anything, it's going to give you temporary relief. And with some people, as is happening in you, Sandra, they don't get any relief whatsoever. You probably need to just rest and make sure that irritation goes down. Then the injections might have a better effect. Injections themselves, and I'm assuming a cortisone injection, which is the most common knee injection that's done. It's a cortisone steroid, anti-inflammatory and pain reliever that's injected into the knee joint. When they put that in, there's no guarantee they're going to take the pain away. And even then, it usually just takes the edge off. It's not going to get rid of the pain 100%. Some people do claim they have 100% improvement in pain. They feel like brand new, but I've seen that that's really the minority of people. Most people will say, it's like 50% better. I can sleep now. I can move around a little easier. I'm more mobile. I can stand and do chores at home without my knee killing me by the end of the day or, an hour into it. So it's not going to fix the problem. What you're looking at fixing is the root problem, which is typically a muscle imbalance, Sandra. When your quad muscles in the front of the thigh are way too strong, they pressurize that knee joint and cause that extra pressure that it's not supposed to be taking. If you have your glutes stronger up in the hip, the butt muscles, that usually shuts off the quads or reduces how much they work so that you normalize the pressures at the knee joints. So we got tons of that information on our channel. If you look through our playlist, I think we've already linked on here the knee arthritis playlist. We talk about that on many videos. Go check that out. It's in the description in case you want more information on how to cure the root problem of knee arthritis. All right, that was a good tangent. Let's go back into the second point. So we're answering the question, will squats help or hurt my knee arthritis? And the first point we made was irritability. How irritable you are depends on if squats are going to help or hurt. If you're very irritable, you should not be squatting. If you're not that irritable, meaning you've been diagnosed with arthritis in the past, maybe you had some pain, maybe not, but today you feel pretty good and you felt good for weeks now, maybe a month or more. You haven't really had any knee problems, then squats might be okay. Now, the next part you need to worry about is technique. Your technique on squats is going to influence whether or not you should pursue squats. Because like I was just saying a second ago to Sandra about the muscle imbalance, when people squat, they tend to use their quads too much, which is part of the muscle imbalance that feeds into knee arthritis and a lot of other knee problems. And so if you can squat using your glutes more, then that reduces how much you're using your quads and it takes pressure off the knee joint, which allows you to now do squats effectively. And if you can strengthen your glutes during a squat, then you're helping your knee joint out. Because one of the big fixes that we preach on this channel and with all our patients that come in here to the clinic If you've got knee arthritis, you need to start getting obsessed with getting your butt muscles stronger. You need to get stronger glutes. And I always make the joke, I'm sorry, you're gonna have to deal with the side effect of having stronger butt muscles and maybe a little more firmness back there. It's just a side effect you're gonna have to live with. But it's true. We literally get patients to come in here and say, my butt muscles got bigger, like in a good way. They're firmer, they're harder. And I high five them and I tell them, great, now your knees feeling better too, right? And they're all like, yeah, my knees feeling fantastic. I can walk longer, do chores at home longer, I'm exercising. We even get people back into running. And most importantly, we get them off the pathway of having a knee replacement, because if they kept up with strengthening their quads, like most people do when they're doing squats, they're eventually going to end up tearing up their knees more, getting worse arthritis, and being in the position later on where they may choose to do a knee replacement. So without further ado, let me show you what I mean when it comes to the squat technique. So you got to be able to see my legs and feet here. Incorrect technique looks like this. You squat down, so feet kind of forward, and then your knees are also coming forward. So most people will squat like this. And if you look at me from the side view, the butt goes straight out back, and my spine, my back here, tips down quite a bit. So my head and shoulders kind of come down towards my knees and towards the floor. And a lot of people will squat like this. And if you're okay to do this, what I want you to do so that you can tell if you're doing the squatting correctly is come down into a partial squat or a mini squat. If you feel like you can go lower without hurting your knees, fine, do so. And just hold here. Just stay here for 5 to 10 seconds, and then tell me which muscles are working. If you feel the front of your knees right here starting to burn and activate and work, you're using your quads too much. Your quad dominance and the muscle imbalance that I'm talking about, you have, and you're not using your butt muscles, because what you should feel on proper squat technique is this burning first and most, rather than this burning first and most. So when I squat like this burns first and it burns the most relative to all the other muscles in my legs. But now to do it correctly, here's what you would have to do. Start with your feet and angle those toes out a comfortable amount, just so that you're balanced. Then make sure your knees are also angled out so that they pretty much go over your toes or even a little outside. Opening up your knees is something I'm going to be talking about in a minute, so just be aware of that. Then next, you got to think about the hips. Just do a partial squat if you're doing this with me. So do a mini squat, not a full out squat all the way down, but just do like a 25% squat, a quarter or a 1/3 squat. And then open your knees up and then drive your hips forward like this. So let me show you the side view so you can see what I mean by the hips. So feet angled out, knees out, drop a little bit, and then shove the hips forward. And see, look at my spine now. I'm more straight. If I sink down a little bit, I tip a little bit forward, but I'm more straight than I was in this kind of a squat. But if you stay like this by tucking your bottom under your spine, shoving your hips forward, try to keep your feet flat. All of a sudden, my quads aren't working as hard anymore. They still are a little bit, but I feel it back here. And if you don't feel it back here, you need to think about tucking your bottom further forward and opening your knees. Watch this from the front. So I'm shoving my hips forward and then opening my knees wide. See how wide my knees are? If I scoot back, you can see how wide my feet are. That's what a proper squat should look like. And I can tell you right now, I feel my buns on fire. And I'm not even going full depth. Just doing a hold like that for 5 to 10 seconds is enough to get those glutes working. Now, if your technique is like that, and I'm doing holds, but if you go up and down and do reps, and you can consistently do it like that, where your butt muscles are the ones that are working, your glutes, then you're going to be in good shape to do squats. So you shouldn't be irritated, and you need to have technique like I just showed you. If those two factors are in place, squats are good for you to do if you have knee arthritis. The technique is challenging to get. I admit that, and I teach to people. Sometimes it takes 3-4 visits to get it right. Some people get it right away. It just depends on the individual. Whew. I got out of breath doing that. So I hope that this helps, this explanation on how to do squats correctly. So I'm just going to run through the comments here, and then I got to get going here. Let's see. All right. So Sandra says, okay, I already answered that one about the injections. Okay, John, Tamika McCoy says, right. Johnny G thing, doesn't squatting strengthen the thigh muscle? And if the squats hurt at a certain point, that must mean bone on bone. Great, great question here. Great comments, Johnny. Um, it, it should not strengthen your quads. Well, let me be super clear. You should drive with the glutes. You should primarily use the glutes. You should think about always making your glutes work the most on a squat. Yeah, you'll use your quads, you'll use your calf muscles, you use your hamstring muscles, maybe even the abs and the back muscles will be used as well. All of that will get stronger as you squat more with correct form, but the feedback, what you're looking for every time you do a squat, is that your glutes are the primary muscle group being used during a squat. If it's your quads, the front of your thighs, you're going to hurt yourself. It's going to increase the pressure at your knee joints and feed into the knee arthritis problem. You may not feel pain right then and there in the moment. In fact, you may get false feedback from people. You may go to the physical therapist or a personal trainer, or you might talk to a friend or somebody who says, let's go do squats. And you do a bunch of squats and they say, do you feel it in your quads? And you get that feedback from somebody, maybe even a healthcare or a fitness professional, who tells you, great, you feel it in your quads, fantastic. And you're leaving the workout saying, I did a good job. I felt it in my quads. I did exactly what they told me to do. And then maybe a week later, a month later, could be even months or years, then your knees hurt. It doesn't happen in the moment always. If you've got flared up knee arthritis, you'll feel it probably pretty soon. But if you're younger or your arthritis hasn't progressed that far, it may take you some time. But you should not push to get stronger quads. And it's very misleading because you see fitness professionals out there on social media that take pictures in the mirror, pulling up their pant leg or their shorts, showing off their massive quad muscles. And you can get that feeling, that burn feeling in your quad muscles in the front of your thigh if you go work them out. And it feels good to have that, it's for somebody who enjoys working out. But it is feeding into that extra pressure in your knee over time. And it's just a matter of what your cartilage in your knee, which your joint can take before you cross that threshold where it starts to become irritated. And once it's irritated long enough, then you got arthritis. So you that's how this works, Johnny G thing. I hope that makes sense for you. Tamika McCoy, thank you kindly. You're very welcome, Tamika. Carol Mescal, bone on bone problem, but have a burning sensation on the outer side of the shin bone. Oh, that sounds like it's probably a nerve problem, maybe like a sciatica problem, Carol. Batol Vasaya, VOR-RED, I'm not sure what that is. Ifam Kani, good evening. I've joined you from London, England. Fantastic. Thanks for coming in from England. My right knee often starts hurting to the extent that it feels like the area under my kneecap is on fire. Whew. I've been suffering from years. I'm so sorry to hear that. That does sound like you've got excessive pressure in your knee joints, likely from this imbalance that I've been talking about. That's what it feels like when it's more acute, or like when you get a lot of pressure all at once. When it's more chronic is when the joint starts to get kind of grinding. You get stiffness in the joint that doesn't let you move. It starts to hurt even when you're just sitting around doing nothing, or at night, or first thing when you wake up in the morning, it becomes stiff and painful. That's very common. Tom Righty, hello. And then Soso Lobi, I actually exaggerated my penguin stance now. I saw you show a proper squat. Haha, great. I'm glad you're doing it right now. Hyacinth Waff. My left knee is my problem. I have been pulling the leg when I walk. How can I fix this? I need more information, Hyacinth. I'm not sure what you mean by pulling your leg when you walk. Like getting a cramp or like a Charlie horse. If that's what's happening, you're probably using the wrong muscles. You should be using your glutes. What I said about the squats transfers over into walking. Our bodies are built to use glute muscles primarily for most leg motions. We're bipedal. We're people that stand. We're animals that stand on 2 feet, or we're beings, organisms that stand on 2 feet. And so glute muscles are incredibly important. Like, you don't see big glutes on animals that walk on all fours because they don't need to. They have other muscles that are big for sustaining walking on all fours, but humans need to stand on 2 feet. So those glutes need to be very strong, and they're in a position on our body where they're at our core, at the middle of our body, so that they can stabilize us. So if you're not using your glutes properly during walking, that could be causing those muscles to be pulled. Gina Veltri. Hi, I never miss your videos. Thank you, Gina. Thank you for watching. I appreciate it. All right, last 2 comments here. Mel Middlemiss. Thanks, Doc. I really feel it in the butt doing it right now. Great, Mel. High five from afar. And Olis Takaryev Vom today. I hope you're doing good, Olis. All right, everybody, I got to get going here. We've been here for 30 minutes. Thanks so much for joining us, and we'll see you guys in the next video. Bye-bye.